8:14 now on this Thursday morning, October 9th. Dr. B joins us, our friend, Chief Medical Officer of People's Health, to talk about flu season. It's officially here. Dr. B, how you doing?
Doing great, Tommy. How about you?
I am okay, sir. Let's talk about the importance of getting an annual flu shot and dispel some common vaccine myths. So I guess let's start with the basics. How does a vaccine work?
Sure. So it's pretty simple. You know, what happens when your body gets exposed to a virus, your immune system kicks in and it starts creating proteins, which we call antibodies. And you want to think of those antibodies as like little soldiers that are there to defend the systems of your body. And they can find foreign substances, things like viruses and even other things, and they can destroy them before you actually get sick. So each time you encounter a new virus, your immune system actually learns how to create these new antibodies that are specifically designed to target the virus or whatever, foreign substance is entering your body. And that process, though, takes a lot of time, and it leaves you at risk for developing symptoms and getting really sick while those antibodies are being created. So that's where vaccines come in. What they do is they actually teach your body how to fight the virus and any other germs before you actually get exposed to them. So your body's ready to go.
So how does the flu shot work?
Yeah, so the flu shot itself, we have a couple of different types, but usually they are a weakened or an inactivated version of the flu virus itself. They cannot give you the flu. They absolutely cannot give you the flu, but they do trigger that response from your immune system to start creating those antibodies that are going to help your body fight off the flu virus if you do get exposed to it. So in the future, when you get exposed, instead of having to wait for your body to create those antibodies, those little soldiers, your body's going to remember and immediately jump into action and hopefully block you from developing the flu.
Is it normal for the flu shot to cause some side effects?
Yeah, I tell patients this all the time. It's very normal, and it does not mean that the shot gave you the flu. That's really important. It actually, what it really means is that it's working, that the flu shot's doing what it's supposed to. It's supposed to trigger that reaction in your body to start responding and creating the antibodies. And so you may get a little bit of soreness where the shot's given. You can even get some generalized muscle aches. Some people say they have headaches. And occasionally, people even have a little bit of a low-grade fever. But usually those side effects are not very severe. They don't last very long. Usually just go to bed. When you wake up the next morning, you'll feel fine. And it's much better than what you would feel with an actual flu infection.
I don't want to downplay that at all, but sometimes you kind of talk yourself into having these side effects, don't you?
Yeah. Well, you're kind of anticipating them, and so you're like, wait a minute, is my throat scratchy? Mm-hmm. Do I have a little headache? And it's probably something mild from the vaccine, but again, nothing to be concerned about.
Why do we need a flu shot every year?
Yeah, so this is really important because I hear a lot of people say, well, I got one last year. I don't need to worry about it. But keep in mind that viruses always evolve, and the flu virus in particular changes every single year. And so we have to update the flu shot that we're giving based on what we're seeing all the way around the world. So in Australia, we'll look at what they got flu-wise, what types of flu, and then we'll create our vaccine for this year. And that protection that you get from the flu shot, keep in mind, it doesn't last forever. It usually lasts about 6 months, but those antibodies will start to break down and the immunity fades away. And so that means you're going to need another vaccine to boost that immunity when the new flu season comes.
Who is it that should get a flu shot?
Really, I tell everybody should get a flu shot, and in particular, it's anyone 6 months or older. There's very rare exceptions. You can talk to your doctor. They will let you know if there is an exception, but it's extremely rare. In particular, I really encourage people who are older, certainly people that are over the age of 50, children that are under 2, may have less ability to fight off the flu. People who are pregnant in particular, it's very, very critical. And then anyone who has a chronic health condition or a weakened immune system, things like diabetes and heart disease, catching the flu can be extremely dangerous.
Are there different types of flu vaccines, or do they come out with one each year and that's for everybody?
Yeah, they come out with one that has the types of flu virus vaccine in it that you need, but there are two different types. There's a shot and there's actually a nasal spray that you can get, but we only use the nasal spray in people that are very, very healthy. Typically, you're going to get the flu shot. That's the best way to go.
I want to talk about some myths when we come back. I want to take an early break for traffic here. We're talking to Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health. It's October, flu season officially here. It's time to get a flu shot, and that's what we're talking about. 8:20 traffic, WWL. 8:24, Tommy Tucker, WWL, talking to our friend Dr. B, Chief Medical Officer, Dr. Brent Wallis at People's Health. And we're talking about flu shots and it being flu season, and we're talking about some myths. So, Doc, if somebody says the flu's just a bad cold, what would you tell them?
Yeah, I hear that a lot, but if you've ever had the flu, you know that is not true. It feels like someone beat you with a baseball bat, and because it can cause a lot more severe symptoms. Some may be milder, but in general, flu can be much more serious than the common cold. It's going to cause more severe symptoms and could result in some complications that even require hospitalization.
I'm healthy. I don't need a flu shot.
That's another popular one, but the recommendation is everyone 6 months and older should get a flu shot, even people that are totally healthy. And while most cases of the flu are probably not going to be too terrible, like I mentioned, hundreds of thousands of people go to the hospital every year, and tens of thousands of people actually die from flu. So that's why it's so important for you to get a flu shot to protect yourself. But keep in mind, you're not just protecting yourself. You're also protecting people around you. The holidays are coming up. You're going to be seeing maybe your parents, your grandparents. The worst thing in the world would be to expose them to the flu because they're going to possibly have more severe complications.
If I stay home when I feel sick, that's enough. I don't need to get a shot.
Yeah, I mean, it is good to stay home when you feel sick. I think that's important. You don't want to spread things around. But one thing to keep in mind is people who have extremely mild cases of the flu or maybe don't even have any recognizable symptoms could still spread it. And that can be up to 30% of people that could be carrying the flu virus through this season. And again, you could infect somebody who may have a more severe reaction to the flu.
What would you say to the people that say flu shot doesn't work? Last time I got it, I still got the flu.
Yeah, I hear that a lot, and it does happen on occasion, but there's a couple of things to keep in mind. Flu shots, just like any vaccine, are never 100% effective. And so some people actually may still get the flu or flu-like symptoms even after they've been vaccinated. But in general, that flu tends to be less severe if you've been vaccinated. The other thing to keep in mind is that the flu vaccine is not immediate. It actually takes a couple of weeks for your body to create those antibodies that you need. And so sometimes you'll get a flu shot and get the flu a couple of weeks later, and it's because you haven't had time to create that protection and everything. And then the other thing that does happen on occasion is we're not perfect, and so we have to reformulate that flu vaccine every year, and occasionally it doesn't cover all the different types of flu that can be floating around, and so you may get exposed to something that the vaccine is not protecting you from.
What would you say to people that don't think flu shots are safe?
Yeah, it's just not true. I mean, hundreds of millions of Americans have safely received the flu shot over the past 50 years, and there's constant ongoing research. They're constantly developing new types of vaccines to cover different strains of the flu, new delivery methods and new dosing. So there is just so much research on it, and all of it has shown that flu shots are very, very safe. So if you have any concerns about it, talk to your doctor. They can really explain the science to you, but it is very important that you consider getting one.
Some very valuable information. Is there a best time to get a flu shot, Doc?
Yeah, there really is. So here in Louisiana, it still was almost 90 degrees yesterday, and so we're spending a lot of time outdoors, and you tend to see the flu when it gets colder, when people start going indoors, and especially around the holidays, like I mentioned, more people congregating together. That's where we see the flu increase. It tends to be kind of the holiday time and then especially during Mardi Gras. And so you want to get your vaccine right now because you need a few weeks for those antibodies to develop. If you wait all the way until December or January, you're not going to be protected through the holidays.
Thank you, Doc. Appreciate your time as always. Dr. Brent Wallis, Chief Medical Officer of People's Health. You can visit the People's Health Medicare Center in Metairie. Find out more at 3017 Vets. That's right between North Causeway and Trader Joe's. Appointments are recommended, but walk-ins are welcome, and I think we're approaching the open enrollment period. You can also visit the website, peopleshealth.com, or you can always call them at 1-800-978-9765. We'll take a quick break. When we come back,